Director of the Government Analyst Food and Drugs Department, Marlon Cole, revealed that some local importers deliberately source substandard drugs. The name of their game is profits, not healthcare. It's not merely a local problem. According to a study by the World Health Organization, 1 in 10 or 10.5% of medical products sampled was substandard or fake, and given the estimated market value of $300 billion in middle and low income countries, it equates to over $30 billion in cost to these countries. Mr. Cole stated that these drugs with falsified labeling have been arriving in Ghana for years, but enforcement has diverted many attempts by importers who use mostly the internet.
We have experience in the past, currently, and we sure in the future, individuals who are knowingly and deliberately supplying substandard pharmaceuticals in our local market. And this has to do and it's not unique to prescription drugs or generic drugs. It has to do with some brand name drugs as well. And so how we plan on dealing with that is using the WHO portal, where we can just take the drug, supply the name, supply the batch code, supply the name of the manufacturer, and the portal will spell out whether this drug is falsified or substandard.
The director stated that the department cannot precisely quantify the magnitude of this problem in Ghana. However, this exposure and alliance will allow the department to double their efforts to prevent, detect, and respond to substandard and falsified products in Ghana's healthcare system.
They estimated the $300 billion against the 10%, and they came up with $30 billion. $30 billion is what it costs low and middle income countries throughout the world as it relates to substandard pharmaceuticals. So what that means then, therefore, that we know for sure, let's say for instance, if Guyana incurring our estimated costs for drugs and medical supply for the Ministry of Health annually, let's say it is $10 billion Guyana dollars. Out of that 10 billion, 1 billion is known to be substandard.
He stated that the first line of defense against substandard and falsified medical products is enshrined in the Food and Drugs Act, Chapter 3404, and is accompanying regulations, particularly Regulation 78, where registration and authorization of drugs are required based on the reliance of efficacy, quality, and safety.
Definitive or specific study has been carried out systematically on the drugs and medical supplies that are in our healthcare delivery system. It could be more, but it cannot be less.
Javon Vickery, HGP Nightly News.